Let's talk about facelift surgery. Pop culture has introduced a lot of debate into what age is too young for a facelift. I think the most important thing to understand if you're a younger patient coming in for a facelift, someone who's maybe closer to the age of 40, is that there's only so much durability that you're gonna get, even in the most expert hands. So the question is, are you ready to get a facelift at age 40 and be reevaluated in your 50s? I think that's something that you need to be prepared to ask when you come for your consultation. As we enter an era of biohacking and of ultra-healthy human beings, there really isn't an upper age limit. It's less about your number when you look at your birthday and more about your physiology. Are you a healthy person? Do you take care of yourself? Can you be medically cleared for surgery? As of now, the oldest patient that I've performed a cosmetic procedure on was 77 years old, and she did amazing. When it comes to facelift terminology, there are a lot of words that get thrown around, and the truth is they have very little meaning in and of themselves. I've heard of a lot of terms such as mini facelift versus full facelift. There is also a huge trend amongst plastic surgeons now to sort of patent or trademark their type of facelift. So you hear words thrown around, I won't name any of them. In essence, what it really comes down to is how large of an incision you're getting and what technique is being performed to address the underlying skin and muscle laxity. Ever since Kris Jenner stepped out into the public, having undergone her most recent facelift, the topic of deep plane facelift has been all the rage. What is a deep plane facelift and how does that compare to other facelift techniques? Well, I would say that the two most common techniques that facial plastic surgeons are using right now are either a deep plane versus a SMAS. And what that really means is where you're making your incision and adjusting the layers. But what both of these techniques have in common is that they're repositioning the skin and they're repositioning the muscle underneath in order to give you the best and most natural results and the most longevity of results. Fortunately for my patients, I'm trained to do both techniques, and while there may be a slight preference for deep plane at this point in time, I possess the expertise and the knowledge to perform whichever technique is best suited to my patient and their anatomy, and this is something that we discuss when you come in for your consultation. When a patient looks pulled or unnatural after a facelift, that's less related to the technique that was performed and more related to errors in judgment that were created by the surgeon. Many surgeons, they try to overcompensate by pulling things extra tight when they're in the operating room. And what can happen is a patient can look pulled too tight, they can end up with widened scars or unsightly scars as a result of the healing process that takes place afterwards. What you really need when it comes to a facelift surgeon is somebody who possesses the right amount of experience to know the Goldilocks amount of skin to remove and how much tightening to perform. Not too much, not too little, but just right. Choosing the right time and technique makes all the difference, and a consultation is the best way to understand your options.